special interest groups are trying to block progress on healthcare reform, derailing the debate with myths and scare tactics. Desperately trying to stop you from discovering that reform won't hurt Medicare, it will actually strengthen it by eliminating billions of dollars in waste and lowering drug prices. Tell Congress not to let myths get in the way of fixing what's broken with healthcare. Learn the facts at healthactionnow.org.
Health insurance with a pre-existing illness. That is our topic right now. If you can get it, though, the premiums, they can be downright outrageous. So in today's Healthcare in Focus, photojournalist Eddie Cortez gives us a look at the challenges facing families with pre-existing conditions.
About 9 years ago, I was diagnosed with Crohn's disease.
Sit. Good.
Without my medication, it gets bad.
She's very hard to live with when this Crohn's is flared up.
I can't eat. I don't sleep. My weight starts to drop.
Even the kids, when it would flare up, they would, can we go somewhere? You know, we just need to get away from Mom for a little while.
I'm without medical insurance. I cannot even get prescriptions that I'm supposed to take every single day. I've got doctor's orders right now for different tests that I can't do because there's no way to cover it. You know, we're making ourselves here with the business trying to just stay above float, and it's like the water's at the nose. That's how close it is. So we don't know where to turn. We don't know what to do. These are the Asacols. They're 400 milligrams each. These are $450 to $500 a month, depending on where you go. None less than $450 anywhere, except for Canada. I'm supposed to take 12 a day, and this keeps my Crohn's under control.
With her having Crohn's disease, it does make it impossible for us to buy insurance that covers anything.
It's voodoo. It's like Crohn's is voodoo. They don't want to touch it. It's pre-existing. When I call to get a quote, they say, okay, we won't cover Crohn's, but once they find out you have Crohn's, even though they don't cover it, they rate the policy extremely high because you do have a disease. It's the one thing we need coverage on, and it's the one thing that we can't get. It's just a vicious cycle. It's like a merry-go-round that you never get off of.
Well, want to know more about healthcare reform? You can check out our website at cnn.com/healthcare and see how the CNN Truth Squad separates the fact from the fiction.